Good afternoon. I am Marco Davis, President and CEO of the Congressional Hispanic Caucus Institute, and welcome to CHCI's virtual briefing on equitable vaccine distribution in the age of the COVID-19 pandemic. We are pleased that this event is presented by the Commonwealth Fund. You know, the COVID-19 pandemic has had a disproportionate impact on the Latino community, with reports indicating that Latinos are 8 times more likely to be hospitalized by the disease and almost 4 times as likely to die from it. This negative impact has been devastating on our community. But now, with vaccines beginning to be distributed, it's important that Latinos have equitable access to the vaccine and that they're armed with full and thorough information about it so that they're not misled and don't have any hesitation in taking it. All of this will help our community move forward, get over the devastating impacts we've experienced, and help all of our society get past this pandemic and begin to experience what has become referred to as the new normal. In a minute, I'm going to have some brief conversations with 2 of our members of Congress, Congressman Chewie Garcia of Illinois and Congresswoman Laurie Trahan of Massachusetts. After that, I'll be back to introduce our moderator, who will bring forward a panel of experts who are going to have a deeper conversation about this topic, including questions from you and our audience. And now I'm very pleased to welcome our first guest. Representing Illinois' 4th Congressional District, we have Congressman Chewie Garcia. Welcome, Congressman Garcia.
Thank you for that introduction, Marco, and thank you to CHCI for leading this critical conversation. I represent a district that includes the northwest and southwest sides of Chicago. It's a working class district with large immigrant populations, and my constituents have been especially hard hit by this pandemic. But even before the pandemic, my district was already disproportionately impacted by high rates of asthma, diabetes, and other factors such as a lack of access to health care, often due to immigration status. The research is clear. These inequities already existed in my community and have only led to deadlier results amid the pandemic. The inequities, coupled with the previous administration's disastrous handling of the crisis, have devastated communities like mine. Early on in the pandemic, I was hearing from my constituents that they had to wait hours just to get a COVID test. And now they are struggling to find appointments to get the vaccine. This is not the same for everyone in Chicago. There are certain areas that have easier access to the vaccine, but many communities of color throughout the country share in this struggle to access the vaccines. I am hopeful this will turn around with the Biden administration, and I applaud their plan to vaccinate most adults by May, but there's still a lot of work to do, important messaging to deliver, and to build trust. Thousands of families are worrying about their jobs and putting roofs over their head. Others have been laid off, furloughed, or had their hours cut, and they're wondering how far they can stretch the last paycheck. Parents are worried about childcare and the future of their children's education. Small business owners are trying to keep the lights on and pay their employees during these uncertain times. The bottom line is that the focus of our federal government's response must center on helping working families across the country, and I'm committed to ensuring that the needs of communities like the one I represent are addressed immediately. Lives are desperately depending on it.
Thank you for that. It's such important work and such a serious issue. And thank you for sharing that background and that context. Congressman, you alluded to it, but if you could give us a slightly more expansive overview on how this first phase of the vaccine rollout is going in your district. I heard you mention there have been some challenges. How would you say overall the picture looks so far?
Well, the vaccine is, of course, very welcome relief for our constituents in the state of Illinois. The 4th district includes many of the zip codes in the state with the highest COVID cases, and the Latino community has been particularly hard. Language and technological barriers remain a top concern. Most information on the vaccine was only available in English, and most registration and outreach has been limited to online activity. That's not good for our community. But the biggest concern, quite frankly, is the scarcity of resources. Our community health centers, advocates, and healthcare workers are stretched thin, and they're doing their best with the limited amount of vaccines. But the bottom line is that the resources they are getting are not cutting it yet. This comes at a time when Chicago, like many other cities, are reopening schools and businesses. People are feeling the pressure to return to normal, but we can't until it is safe to do so. And in order to get us a safer place and return to some form of normal, we need more vaccines. And the good news of the last couple of days is that they appear to be on the way. We're ready to help get them in people's arms.
That's great. That's great. Thanks. And so based on those challenges, can you share if you've seen any best practices in your district or otherwise or elsewhere that have helped with vaccine distribution, particularly helping these underserved communities?
Happy to say that since last year, Marco, a coalition of Latino local elected officials, health experts, advocates, and others have mobilized and formed the Illinois Unidos Coalition to coordinate state and local efforts to protect and serve our communities during the pandemic. As a coalition, we've made sure to be at the decision-making table and to be heard. It hasn't always been easy, but our priority is to ensure that our communities have the resources that they need. Specifically on vaccine distribution, we have led countless events to educate and inform our communities about the vaccine in order to fight misinformation and vaccine hesitancy. We've created hotlines and hubs for residents to connect with trusted members of the community in their primary language to help answer any questions. With the limited resources, we understand this has to be a coordinated effort. We can't do it alone. However, I did want to highlight one of our coalition members, a CHCI alumni, Miguel Blancarte Jr., who is working endlessly to advocate for our underserved populations and to ensure that our community has access to testing and the vaccine. Miguel and others have had to step in and lead where there are remaining gaps and lack of resources. So there's good news about the contributions of CHCI alumni.
Well, thank you for that. We're really glad to hear that Miguel is doing great work there, and appreciate you mentioning that. And so based on these insights and these things that you've learned, not to mention drawing on your tremendous experience as an organizer, what do you think are measures that officials can take to make sure there's equitable vaccine distribution all across the country?
Well, because of the lack of resources currently available, state and local elected officials have been forced to strategically distribute vaccines. And unfortunately, communities of color, the same communities dying at higher rates, have been overlooked. Under these circumstances, Illinois Unidos has fought to secure, in partnership with trusted organizations, our community health centers are stretched thin, and they're working with the limited vaccines they have received. I'm fighting to ensure that they have the resources and funding available to educate and ensure our constituents have access to the vaccine. Finally, we need to have a more centralized form of educating people of their options. We need a better platform that includes all federally qualified health centers, pharmacies, etc., that are offering the vaccine, and this information must be available in multiple languages and not solely online, because that creates a great disadvantage for our community, especially the elderly in our community.
That's great. It's great. Thank you for sharing that. And finally, my last question is, we've heard that some of the concerns people have shared are that there is some hesitance, there's some reluctance among some segments of the population to get the vaccine even when it's available. We know, of course, that this is based on historical distrust of the government for good reason, based on bad implementation of policies and just frankly, outright mistreatment and exploitation of some of our community. Knowing that some argue a big portion of the problem is actually still access and distribution and equitable distribution. Nonetheless, what would you say to constituents who are hesitant to get the vaccine because of that distrust, because of those concerns? What would you say to them to perhaps reassure them about getting the vaccine?
There remains a historical distrust of the government and of the medical community among communities of color. And Latinos, Latinas are not the exception. Illinois Unidos members understand this deeply rooted distrust. Aside from the scarcity of vaccines, we also understand that the vaccine hesitancy remains an issue and part of the reason that communities of color are less likely to receive the vaccine. Whether it's conspiracy theories or bochinche or chisme in the neighborhood expressing skepticism of the vaccine. But even before vaccines were distributed, we knew we had to educate and address the ongoing misinformation, which is why we've worked so hard to provide materials in Spanish, host town halls, and many other outreach efforts. We've also pushed to ensure that trusted community members, such as promotoras de salud, are leading these efforts. And most importantly, we're leading by example. One example, Dr. Marina del Rios, another Illinois Unidos member and the first person in Chicago to receive the vaccine, has helped address concerns, navigate the barriers to getting the vaccine, and reassured people that the vaccine is safe. And finally, I remind everyone that it is our moral obligation to protect the most vulnerable communities. We're doing this so that you can see your abuelita, who you haven't seen in a year, our grandchildren, my nietos. We're doing this for the diabetic neighbor who is still scared to go out, and for all of the essential workers who have kept this country running. And I encourage everyone who has already received the vaccine to talk with your family and friends so that they can do the same. We can and will overcome COVID-19, but we need to do our part by getting the vaccine when it's your turn to do so. The vaccine alone will not end this pandemic, but it will certainly get us closer. And finally, our communities desperately need more resources from the federal government. I voted in favor of the most recent relief package because Latino communities across the country, including the ones that I represent, continue dying at alarming rates. So it is our duty to be the best ambassadors possible, to be the friendliest and reassuring people possible, because we have an opportunity to, in the coming months, crush the virus and return to being able to gather with our loved ones and our community.
That's fantastic. Thank you so much for those very powerful words, Congressman. Thank you so much for the work that you're doing, not just in your district, but also in the halls of Congress on behalf of all Latinos and all Americans to really fight this pandemic and to try to make conditions better for all of us to get the vaccine distributed. Please keep up the good work. Thank you once again for your leadership and for being here with us this afternoon.
Gracias, sí se puede.
And now it's my pleasure to welcome our next guest, representing Massachusetts 3rd District, Congresswoman Laurie Trahan. Hi, Congresswoman. Thanks for being here.
Oh, thank you, Marco. Thanks for inviting me to be part of this important discussion. And of course, thank you to everyone who are tuning in and being active on this issue, which is affecting communities and districts like mine across the country. This conversation is especially timely for me after last Friday, when I had the opportunity to tour a vaccination site that was set up by our incredible community health center in Lawrence, Massachusetts, one of the few predominantly Hispanic communities in Massachusetts where they're working overtime to get shots into arms in traditionally underserved neighborhoods. Logically, that tour was a catalyst for a conversation about how Massachusetts is doing when it comes to ensuring that the distribution of COVID-19 vaccines, the single greatest tool we have in the fight against this virus, is equitable. As of Friday, there was a 7% gap among Hispanic Bay Staters who make up 12% of the Commonwealth's population receiving at least their first vaccine dose. And, that's not just a problem unique to Massachusetts. In fact, in conversations with my colleagues in the Congressional Hispanic Caucus, that's an issue we're hearing about in communities with larger Hispanic populations nationwide. And that's why one of our key priorities in President Biden's American Rescue Plan is allocating $27 billion to addressing health, racial and ethnic disparities, and protecting vulnerable populations for the duration of this pandemic. So I'm so excited to start this conversation. I know that there are we want to get to questions, and I just want to say thank you for taking the time to be here for this discussion. I look forward to continuing to work with you to make sure no one is left behind as we work to get as many shots into arms as possible.
Wonderful, wonderful. Well, thank you. Well, and let's get into the questions then. So we heard just a few minutes ago from Congressman Chuy Garcia and sort of what he was seeing on the ground in his district. And so I'd like to ask the same set of questions to you. So first off, you've alluded to a little bit, but I wonder if you could elaborate a little more on how this first phase of the rollout of this vaccine has impacted your district in particular. What are you seeing on the ground?
Yeah, no, I'll be the first to say that Massachusetts has done well in certain facets of pandemic response, but I think most folks would acknowledge that there were some stumbles immediately out of the gates that led to an initial lull in doses administered. I'm glad that our governor and his administration took swift action to remedy the issues, some with their website, and stood up a call center that folks, especially our seniors and underserved populations who may not have access to the internet or a computer, can use to schedule their vaccine appointments in English, Spanish, and equipped to translate into other languages. The fact of the matter is that for the better part of the last year, the federal government has passed the buck onto states to respond to this pandemic. It started early with the mad dash we saw in April of last year to get PPE to hospitals and the bidding wars that unfolded between states and even between them and the federal government. And it continued with the previous administration's refusal to support additional state and local government relief, forcing them to bear an even greater share of the costs associated with responding to an unprecedented health crisis, something that disproportionately affects communities like strong working class and immigrant communities like Lawrence and Lowell. And we saw that same pattern again in the early weeks of the vaccine rollout, not giving reliable visibility into when doses were actually coming. Now, fortunately, that's changing with the Biden administration, but even they'll tell you that it's going to take some time to get their federal response plan into a good enough place that vaccines are rolling out the door at the levels we need. But the early reviews are promising. We're hearing from Republican and Democratic governors alike praising the communication and responsiveness of the Biden administration. And that's a good sign and something that needs to continue to be improved upon in the weeks and months ahead.
That's great. That's great. Thank you for sharing that overview. And what have you seen that's working? What are some of the best practices that you've seen in your district that helps with distribution, particularly to these underserved communities like the Latino community?
Yeah, as I mentioned, it was just last Friday that I visited a vaccine clinic in Lawrence, Massachusetts, and at a community health center, which has one of the largest Latino populations in my district. And we talked about healthcare disparities and making sure that we're accelerating and making vaccine distribution equitable. The partners on the ground, like our community health centers, are the ones doing it. The hardworking folks at the Greater Lawrence Family Health Center have gone above and beyond to get our community through this pandemic and save lives. You know, their commitment to serving others continues as they work to administer vaccinations to thousands of eligible Lawrence and Methuen residents. But even more than that, I've also seen the mayors of Lawrence and Methuen, which neighbors Lawrence, go above and beyond to try to reach the folks in their communities who aren't accessible through the normal platforms that we often think about, like TV, radio, and social media. And they're going into senior housing centers. They're going to where people are. And I think that's the name of the game, right? Is we know where people are, where they are in community, and actually bringing the vaccine to them is a core part of what we're seeing work on the ground. And so that is, that's how we're going to defeat this virus, is by making sure that we're getting as many shots in arms as possible, and not being stubborn about how we administer that vaccine, but going to the communities that we know want the vaccine just as much as everyone else, but might be harder to reach.
Yeah, that's great. Thank you. And you mentioned, for example, that, some of the governors had to really improvise and be creative in doing some of their things. Are there other things that folks can do? What do you think are any other measures that officials can take really throughout the country to help make sure that there's an equitable vaccine distribution in all communities?
Well, the very first thing we must do is pass President Biden's American Rescue Plan. I mean, this is critical legislation. It will be up for a vote in the House in the next day or so, where I will vote immediately to get relief to the American people. But in addition to the much needed direct relief for working families who have, struggled for months to make ends meet, the American Rescue Plan addresses disparities, $27 billion to address health disparities and protect vulnerable populations for the duration of the pandemic. It helps our community health centers, which are on the front lines in administering these vaccines to our underserved populations. Similar to the CARES Act, the American Rescue Plan allocates $7.6 billion in funding to further support COVID-19 response efforts at our community health centers. And then, the Greater Lowell Family Health Center, which I mentioned in Lawrence, also stands to benefit separately from the $330 million allocated for teaching health centers to continue training our medical professionals who serve the most vulnerable in our communities. Additionally, the American Rescue Plan establishes a long overdue national COVID-19 vaccination plan and provides more than $20 billion to improve the administration and distribution of vaccines. And that includes vaccination sites. It includes $7.5 billion for FEMA to establish vaccination sites across the country. That is the significance of this president's investment in community health centers and the community health center vaccination program specifically. Last month, the president announced that this vaccination program would provide direct funding and supplies to our community health centers to ramp up their vaccination efforts. And these community health centers in my district were beneficiaries of that. And so I praise that announcement of this critical program when it was first announced, because, communities like Lawrence and Lowell and Fitchburg, all part of the district I represent, they know how valuable additional vaccines separate from their state allocations are to ensuring that traditionally underserved communities aren't left behind as we work to get shots into arms. And it's, my understanding that last week marked the first 2,000 dose shipment of these federal doses. And I've made it clear to the leadership at the Greater Lawrence Family Health Center that if they need any assistance as they move forward in the program, we'll always be available to help. But now what we must do is support them even further by allowing them to get the job done by passing the American Rescue Plan.
Great, great. And Congresswoman, one last question. We know that access, and we've just talked quite a bit about how access is a real challenge. There's also a potential challenge that on occasion is already showing up and that folks are very watchful for, which is there's been talk of a reluctance, of a hesitancy among some in our community to get the vaccine once it becomes available, right? And we know that there's some misinformation going on, and there's some efforts to mislead folks into being more skeptical. But sadly, we know that there's actual historical precedent, right? Our community has been deceived, our community has been exploited, and so on. But we know that this vaccine is really critical. We know that it's safe. We know that it's being distributed all over the country. So my question to you is, what would you say to constituents who are hesitant to get the vaccine, whether it's because of historical distrust of the government or for other reasons? What can we do to help allay those fears and help them become more amenable to receiving the vaccine once it becomes available?
It's a great question, and I'm happy that you asked it. You know, the first thing I'd say is that the vaccinations are safe. No corners were cut in their development, and I trust them completely. That's why I went out and got my vaccine as soon as I could, and that's why you should too. I'd also say that I'm fully aware of how difficult the past year has been on all of us. We've all had to make sacrifices to keep ourselves and our loved ones safe, which is why I was thrilled to see the CDC's newly released guidance that people who are fully vaccinated can safely hug and enjoy each other's company inside and without a mask on. I mean, that's important for families like mine who haven't been able to have our entire family, our grandparents, our grandkids, our nieces and nephews together since early last year, and who have been eagerly waiting for guidance like this since then. So, you know, when I sat in at the Greater Lawrence Family Health Center and I saw chairs basically full of people who were emotional to get their vaccine, it's because, one, they're with a trusted provider. Our community health centers have been on the front line throughout this pandemic, and them administering vaccines to people in the community that they know by name is so important. But it's also marked a huge milestone for so many families, for so many seniors who are really looking forward to this light at the end of the tunnel. And so as soon as you're able, go get your vaccine.
Wise words and really profound insights. Thank you so much, Congresswoman Laurie Trahan, for being here with us today. But most importantly, thank you for your leadership, fighting for our community and for the American people in the halls of Congress every day. We wish you well. And thanks so much for being with us.
Thank you. Thanks for having me.
And now it's time for our panel. I am pleased to introduce the moderator for this afternoon's panel, the senior Washington, D.C. correspondent for Noticias Telemundo, Cristina Londoño.
Thank you very much, Marco, and welcome everyone to this panel segment of our event hosted by CHCI and presented by the Commonwealth Foundation. I want to thank you especially for inviting me to moderate today's discussion, which is very close to our hearts at Comcast, NBC, Universal, and Telemundo. As you know, we have launched a company-wide initiative, planyourvaccine.com or planificatuvacuna.com, to help along the efforts in the fight against COVID and getting people vaccinated and getting back to our lives and to hugging all those people that we love. I also like to mention that we pre-recorded the congressional part of this program, and that's why Congresswoman Trahan said that she was hoping the American Rescue Plan would get approved. It was approved, and we're waiting for it to be signed tomorrow at the White House. It is now my honor to introduce today's esteemed panelists, Maria Gomez and Dr. Matt Barreto. I will give you a very brief intro because their full bios can be found at this event's webpage, a long list of credits and accomplishment from them both. First, I'd like to introduce Maria Gomez. She's president and CEO at Mary Center, a community health center serving the diverse communities of Washington, D.C. for over 30 years. Maria is also a registered nurse with a master's in public health. And political scientist. Dr. Matt Barreto is a professor of political science and Chicano studies at UCLA and co-founder and president of BSP Research. It's a firm that specializes in political data and research on America's Latino communities. Thank you both for joining us today. And also, we have to welcome our audience. We invite you to submit your questions on Facebook Live, which we're going to have time to address it later in the program. And also, you can join the conversation on social media by using the hashtag CHCI COVID-19. I'd like to jump right into this crucial discussion with quick recap of statistics that we just mentioned. According to the Centers for Disease Control, Latinos accounted for over 30% of the nation's COVID-19 cases and were less than 20% of the population, 8 times more likely to be hospitalized and 4 times more likely to die. Maria, can you please speak as to how health disparities, particularly within the Latino community, and how they might be complicating the COVID-19 vaccine rollout? Maria, we can't, I'm sorry to interrupt. We can't hear you right now. Are you there?
Oh, sorry. Sorry.
Yes, go ahead. No worries.
Okay, so Christina, thank you very much for this important question. I think the 2 congressmen summarized it. First, our Latino community already had a very low rate of insurance and very complicated medical histories that were not attended to, right? Our community, for the most part, are in jobs that are in the front lines. Many immediately lost their jobs after the pandemic hit, and we were able, for instance, at Mary Center to be able to give $1,000 to families that were raised with private funds. I'm still extremely touched by a woman that said to us that she could not feed her children, and she had just been thrown out of her apartment because the landlord knew that she couldn't pay the rent. Her response to us when we asked her, what could we help with, her exact words were, "At this point, it is best that none of us continue living." So to continue the disparities, the masks, as you know, were inaccessible for any of us, and even if you could pay for them, and much less for our community. And therefore, our community was extremely exposed. Some businesses, to stay afloat, gave the alternative to our folks to either work without a mask, bring your own mask, or stay home. That's what our community chose. Still, our families are in need of masks at this point. Some families depend on public transportation to get to their jobs. As we know, public transportation came to a halt for many, many months in different parts of the country, definitely here in this region. Without a job, our community was doubled up and triple housed, exacerbating the exposure. The fear of being noticed in crowded housing or unstable, or having an unstable immigration status really, really exposed people to very vulnerable to this virus. Many refused to give their address when the departments of health tried to contact them for trace it. They knew they were living in crowded conditions. So got their jobs back. Many could not go back and still are not back because they don't have childcare and because their children are all still doing virtual schooling. And the last thing I would just say is that the surmountable number of barriers has added, as I mentioned with the woman who told me that, and just many, many more tendencies of suicidal tendencies. And how does this complicate the rollout? I mean, basically, the rollout is the same, right? That there's just, people who are not able to get out of the house because they have children who take up their whole time. The elderly who can get the vaccines have to be accompanied with adult child or who should be getting vaccinated, but because that adult is 40 years old and in good health, that person is not being vaccinated. So there's a lot of barriers right now. I think the other one is because people are not many people are not in community health centers or attached to a hospital. They're not getting that phone call that says, come and get your vaccinations, right? So our community is being disconnected that way.
Well, you just touched upon a very important point. We had that problem, my sister and I, deciding on how to take my mother to get vaccinated. She needed to go, and it becomes very hard. It's even harder if they have to be on public transportation. Dr. Barreto, from your research with Latino communities, how do you feel they have taken this pandemic? Is there a sense of abandonment, resignation with regards to the government's response? Do they feel completely left out at the moment?
Well, thank you, Christina, for the question, and thank you for moderating us. I also want to thank Marco Davis for bringing us together and the invitation to bring Maria and I here. As Maria explained, this pandemic has had a major, devastating impact in the Latino community. And in terms of our view of the role of government, this has now transcended two administrations. We have to keep in mind that this pandemic happened against the backdrop of the Trump administration, which many argued was not taking the science seriously. But what goes without any debate is that there was an anti-immigrant culture in our last administration that made it very difficult for the average Latino family to get information and to trust whether they could even go to a community health clinic. And so that was something that we saw in the research that we were doing. You know, we started doing research on how Latinos were impacted by this back in April, only 1 month into the pandemic, with our partners at Somos Community Care. And I just want to, acknowledge and thank Henry Munoz and Somos Community Care for funding that, because we got some of the earliest data on what was happening in the Latino community, and we saw very low levels of confidence in the way that the government was rolling out the response. So we saw those high rates. We saw those high rates of exposure. We saw those high rates, as Maria said, still going to work. In our survey, we asked people who were still going to work, and over 1/3 said that their workplace was not providing any PPE, that they felt at risk, and they were out there doing this essential work while getting low wages and not even being taken care of. And so we saw that spread throughout the community, and that was devastating. Now that we're at the vaccine point, we have a different political administration. We've had an election and a change, and it is extremely important for us to get the word out now that everyone is eligible for this, free of cost. You're going to be eligible for the vaccine. The vaccine is safe. It's accessible. It's going to be available in English and Spanish if you need that information. But we have to increase and ramp up that outreach, because that's the question that we keep seeing in our data, in our surveys, Christina, is how do I get information? Where do I get access to it? And so we need to do more to ensure that the Latino community is informed and is confident in their access to this vaccine.
Thank you, Dr. Barreto. Let me throw out some new numbers. Almost 59 million people had received at least one dose of the COVID vaccine at the beginning of this week. 30.7 million had been fully vaccinated. Providers are administering an average of about 2.16 million doses per day. But the good news is not as good for Latinos. It's only 8.5 of the people who have received one shot are Latino, and 6.5 are African American. We have just talked about all the reasons why, the distrust, and we have just both of you have said that we need to get the word out, that they can get vaccinated, that they're not going to be persecuted, that ICE is not going to be at the clinic, and all these things. But we're fighting against a huge enemy, which is misinformation and disinformation. As a Latina reporter, I had COVID in May, and the disinformation at that time was that COVID didn't really exist. I caught the virus. So I went public and I told people it does exist, and I'm not making it up. I didn't have to go to the hospital. I was happy that it didn't hit me personally. It's caught up with me lately with people that I've loved. I've lost friends and people that I really did care about. But people at that time didn't feel it coming that close to them. And now we have the vaccine, and we also have misinformation and disinformation. I've had comments saying that superstitions, I wrote some down, they're saying that they're inserting microchips, that it's the mark of the devil. We're fighting against them, and this information appears to be getting through in the internet faster than any of the other community efforts. What have you done, Maria, to combat this misinformation?
Yeah, so I think that for us it's really education, right? To let people know that I think any vaccine is great. I think it's important for the community to know that the Latino community was represented quite well in the trials of the vaccines. And I'll just put a plug in here that as a community we need to really participate, in all of us in the trials in pharmaceuticals, to make sure that we are well represented. But this vaccine, we had great representation. And the important thing is to let people know that it has proven to be effective to tremendously decrease the side effects of including hospitalizations and death, right? Even though you might still get the virus, you are less likely to die or be hospitalized from it. A strong message, as it was said earlier, about receiving this vaccine will have to really talk about that this has no impact on the immigration process in the future. So many people have talked about that. But I also want to emphasize there are a lot of people also who are ready to take it. And we need more vaccines, and we need to give them out as soon as possible. There should be, we should make sure that we send a message that there's no cost, like Matt said, Dr. Barreto, there's no cost to these vaccines, but there's going to be opportunists out there that are going to try to charge our community to get this vaccine. We need to be advocates, I think, health departments, that vaccination should be in the communities that we know where people are suffering. These town halls like this one are essential. They're essential to dispel the myths and to really, for us, for instance, even though I'm a community health center, we had a lot of hesitation in our community within the center of people who wanted to get vaccinated, including nurses, believe it or not, and a large percentage of nurses who were very hesitant. And having the town hall, we went from vaccinating 100 people to within weeks vaccinating over 600 people. So it does work to have people that get into calling patients personally and inviting them to ask questions and to encourage them to come in and get the vaccine. We like to get to a point where the vaccine is available for everyone. Right now, because it's available to a certain age and a certain category of people with certain diseases in certain places where they work, it really puts a barrier to families, right? Because our familia goes together, right? La abuelita, the daughter, the granddaughter, everybody goes. It's important that we have available for everyone. Encouraging, I think it's going to be very important to encourage our clergy and our schools to participate, for us to be able to continue to come in at the sites and vaccinate. And we know where the hotspots are. Dr. Barreto and others have said, we have tested people. We know what those hotspots are. We should go into those neighborhoods and vaccinate. And then I think one of the things that has been offered is the National Guard to help vaccinate. And there's been discussions about whether the military should be involved in this. And I feel very strongly that we can disguise them, put them in a gown, and put them to work. There are plenty of them out there that are not doing anything right now, and we should really utilize the National Guard.
Dr. Barreto, I saw you. You want to get in on this misinformation, disinformation? How do we fight it? How do we fight people who are saying, I'm going to wait a year. I don't want to be a lab rat?
Yeah, absolutely. Well, the first is to Maria's point that many Latinos were included in the trials. And this has been tested across communities. It's very important in studies of race and public health that as we do our clinical trials, we need to make sure that they are racially diverse. And this is getting much better. And in this specific case, all of the companies involved had very large samples of Latinos and immigrants in their trials. And so we know that this will work for our community. We know that it has efficacy. And now we need to get that message out. There is absolute disinformation happening. It's in social media, it's in YouTube channels, in WhatsApp threads, and we need to make sure we combat that. Our research has demonstrated the most trusted messenger on this issue are Latino and Latina doctors and nurses and healthcare providers. So while this disinformation is out in the environment, we can combat it with people like Maria and her colleagues and others who are there because we trust those positions. We have held them in esteem in our community, doctors, nurses, and healthcare providers. And the other trusted messenger in our community are people in your profession, Christina. So the more people who are Telemundo and NBC and Univision también, those people getting the word out because you speak with our community every night. And to tell them that this is safe, that this is something that's happening, and interviewing and bringing more Latino doctors and nurses in, I think will be helpful. We have to do that because what you observed in May is continuing in full force today. There is an anti-vaccine movement. It is happening in Spanish, and it is impacting. We're getting these questions all the time from our tias and abuelas. Is this true, mijo? Did you hear this? And now we're doing that, and we're combating that. But we need to do this collectively. But the good news is the research suggests that when people hear about the safety, when they hear trusted healthcare providers telling them, they are interested in signing up and moving forward. And so we just need to continue that effort.
Quick question for one of our trusted voices, Maria. You are one of those trusted voices. People believe you. And this is a question from our Facebook Live, Angel Tapia. He wants to know if there are specific efforts to get undocumented individuals vaccinated.
Absolutely. That is a population that we want to get to immediately. And what we're doing and what I think many states are doing is just, and I think looking at doctors' offices and community health centers, looking at their patient load and really looking at what are the comorbidities, what are the illnesses that people have that qualify them to get the vaccine, even though they may not be 65 or 75 or whatever the cutoff is in the particular states. But we are particularly really emphasizing our undocumented community because they are hidden, they want to hide, they're scared. And so that's a community that we want to bring, and that we not only want to bring to the centers, but we actually want to go to their communities in their own neighborhoods and provide the vaccine.
Another question that's coming from our viewers, and this one is from Deanna Rumsey. How can we partner with disability advocates to promote vaccine distribution that meets the needs of Latinos who have disabilities, including mobility, vision, hearing impairments? Do you know of any efforts where there would be like a take-home vaccine? They would just drive over to your house and put your shot at home. Is that in the world?
There are those, and I think the health departments and that's something that, as an advocate, you should emphasize. Health departments have some money to be able to do that, and there are physicians and there are entities like there's a group called Five Medicine that actually will do that. Go to churches if people can be brought to the churches. If not, they go to individual homes to give the vaccine to those individuals. So we need to advocate so that our health centers, our health departments realize where those communities are, and we need to point them to them and tell the health department, this is where you need to put your money.
Dr. Barreto, this is another question that's coming from people that are watching this right now. As the health sector works to address health inequities during the pandemic and vaccine rollout, how can these methods be used to address public health challenges in the future? In other words, this pandemic has brought to light problems that we already had, but it just set them right in front of our faces with the most tragic of consequences. How are we going to learn from this? How is this going to change us moving on?
I think that's critical, that it has exposed the inequities, not only in our public health system, but in our social safety net in general. We had so many people that were living paycheck to paycheck already in our community, and they were getting by because the next monthly paycheck came in. And when that stopped, You gave us stories of people getting evicted from their house, of not having enough food on the table. So this is systematic. It's not just in the public health disparities, but that is absolutely real. And I hope that this puts attention. Now that there has been a change in the administration, I believe that there are more open ears in Washington, D.C. To listen and think about this. You know, when the vice president, Kamala Harris, was a senator, she introduced a bill on racial equity in healthcare rollout, not only related to COVID-19, but to address some of that systematic inequity that was there. And I believe that that will be followed up on. We need to use this, but it only happens if we put that pressure and if we draw attention to it. And so our members of Congress, you heard from 2 members of Congress earlier, both who indicated they care about these issues. We have to not just get through this pandemic. We have to use this as an example to fix not just public health, as I said, but all of the safety net system, the access to our government, to make sure that it is equitable and that people are not falling through the cracks. So I think we need to work together. The research and advocacy that we are doing is going to continue in that direction. And I think that all of us will continue pushing on this to address those gaps.
Yeah, Christina, if I may add, thank you, Dr. Barreto. I may add that a good example of that is like telehealth medicine, right? It's not for everyone, but when there is internet and there is a computer in the home and you have an elderly person or somebody who's, with a disability and there are younger people in the home, telemedicine has been a tremendous lifeline for people, not only for medical problems, but literally a lifeline for people for not committing suicide. So we need to make sure that we don't go backwards and that we move forward with technology. I mean, we use technology in good ways and bad ways, and this one is one that we need to move and propel forward as much as we can.
And I think this is one of the big points that we should highlight is the Latino community is very much connected. We're on Facebook, we're on WhatsApp and everywhere, because that's the only way the community has a chance to speak to their families back home. So it is a connected community, but we have had the disinformation run ahead of us of all these public campaigns. Maria, I have a message for you from Antonio Tijerino. Thank you for always representing Maria. You're an inspiration. And I have a question for you also from Ivan Mesa. He wants to know what we know about vaccination for children 17 years old or younger.
So maybe Dr. Barreta, do you want to answer that, Dr. Barreta?
I can. There are movements being made on vaccines under 16. Up to 16 right now, I believe, will be approved by this summer. Those are also being tested on the 12 to 15 population as well. And there are expectations that by the end of or early in 22, 12 to 15 might be eligible. But I believe 16, 17 is already in the works, and that will be coming very soon, as early as this summer. The trials have already been done, and so as schools are reopening and activities are coming back, my understanding is that we will soon have our children, at least the older segments of them, be eligible for vaccines. Maria, I don't know if you have different.
Exactly right. I wanted to give you that opportunity, and I think one thing to just add is that for the 17 plus. There are some vaccinations being given for, especially if children have any kind of disabilities at this point. But it's it depends on the state, and right now they're prioritizing the elderly, and I totally understand that. But I just wish that I'm begging the Congress and the president that we need to have enough vaccines so that we can actually vaccinate everybody who wants it whenever they want it.
And now I have 2 very similar questions, but it's definitely, I believe, the biggest challenge that our community is facing right now. We have talked about this point. We have made it over and over again. And here it shows up in the question. Daniel Hernandez wants to know how we can collaborate with other like-minded groups to increase the reach of fact-based information to our community. He wants to know if there's a coalition where you can address misinformation present in our communities. And then I have another question of a person that wants to know how they can personally help combat mistrust around the COVID-19 vaccine with my own family. I am nervous to confront my family members who believe the disinformation around the vaccine. This is getting to the point where there were Trump and Biden voters in the same family. Now there's vaxxers and anti-vaxxers. This is becoming a real issue in some families. How do you talk to family members who are afraid of getting vaccinated?
Well, let me answer you the first question. I'll let Matt take the second one because I think I might say the wrong thing on that one. So, because I'm adamant about something that I probably shouldn't say publicly. But anyway, so I think that the first one, there's one group that I would suggest definitely is the Black churches, the national Black churches. They're doing, I think, a super job of getting the word out, in getting the churches really, really involved. And here in this region, they're really reaching out to the Latino community and saying, let's kumbaya together on this because it's affecting all of us, and because they understand we live together, we live in the same neighborhoods, we that's one place to really reach is to the Afro-American community.
Dr. Barreto, on how to talk to your family?
Yeah, well, I don't know if you want to talk to my family because I've got some of those same same folks on both sides of the issue. But we've all seen it in our group texts, WhatsApp chat, on Facebook Messenger, and I think the key is to lead with facts and information and to be an example yourself. And so, if you or someone in your immediate circle has an opportunity, get vaccinated. And talk about that experience. I think talking about that experience of being vaccinated is very important because it demystifies it and it allows you to earn trust. Let's say you went through and got vaccinated and had no issues at all. On the first dose that I got right here in the arm, I just had a slightly sore arm for a little while. I had a friend who developed a very, very bad headache, but that was it. The next day he was fine. And so I think just talking about it demystifies it. And so if you yourself can get in there and be a leader in your friend and family network, you can tell people that this is okay, that the effects are not what you're hearing, and just remind them about facts and information. But leading with examples is always the best way to go. And I think that will be the safest way for a conversation. Be respectful. Of course, you don't want to make things worse. But the more examples you have, people learn from evidence. They see things before their eyes and then they start to trust. And it is true that this process for getting this vaccines did move quicker than others. But that wasn't because there were shortcuts. That was because we put so much investment and resources, and so many companies and the federal government worked together to speed up the process. And so, as Maria already said, the trials have been done. The science is very clear. And now if you yourself can get vaccinated or someone in your immediate circle, you can talk about how that experience went and that you're still there and you're doing well and now you're safe.
Thank you, Dr. Barreto. Well, we're almost at the end of this program. I would like both of you, if you want to give some closing statement, your last message to people out there watching us, what would it be, Maria?
Yeah, I would say that my message is to please get vaccinated for yourself first, because you love yourself, because you love your family, because you love the livelihood that you have, and to please speak to your family and see who they're getting the information from, and if it's the clergy, or if it's a teacher, or if it's the store down the street, go talk to them, and you take it upon yourself to educate those folks.
Dr. Barreto.
Yeah, I think, in particular, I want to remind people to continue to have discussions in their community, to be asking questions about your friends and your family, and also just your other community members when you interact with others in our community, especially those who are more vulnerable, if they happen to be undocumented or if they happen to have health risks. Encourage them to get vaccinated. Help them. Take the time. This is the chance for all of us. If you're wondering, what can I do? Maybe spend that day tracking down how to sign up your elderly neighbor on the state vaccine website. These are difficult things that require a lot of work, but we all need to work together. And so even if you just help get 1 or 2 people vaccinated, that will go a long way. And don't give up hope, because we are purchasing and rolling out millions and millions of more doses. There was a lot of slowdown at the beginning. All right. And we know that the previous administration just didn't take it as seriously as they could have. There was not enough vaccines ordered. That has all changed. We're playing catch up. But in the weeks and months to come, there's going to be massive rollout of millions of doses. Please help your community and your family get access to those, because it's going to help us return to some normalcy.
Well, I want to thank you both, Maria of Mary Center in Washington, D.C., Dr. Barreto, professor at UCLA, for your expertise, your leadership on how the country can ensure equitable health care and COVID-19 vaccine distribution. I want to invite you to, you have done here. I want to invite everybody who shared their questions. If they want to continue conversations, they can do so on social media with the hashtag CHCI COVID-19. I want to thank the Congressional Hispanic Caucus Institute and the Commonwealth Foundation for gathering us this afternoon for this absolutely critical conversation. You can sign up to attend more CHCI events and learn more about the mission to develop the next generation of Latino leaders. And a brief comment: before, we didn't know, we had mistrust if the pandemic was true or it wasn't. And now we're sad to say that over 500,000 people have died. I am sure most of us have had somebody close who got very sick, somebody we feared losing, or somebody we lost. We now know this is a reality, and we know that the only way out of it is getting vaccinated, and we can get back to life. We can get back to hugging the people we love. And I'll invite you all. Let me put on my Planifica tu Vacuna hat. This is a great initiative. You don't need, it takes the guesswork out. You can plan your vaccine, and you plan birthday parties, you plan weddings, plan your way back to freedom and to a normal life. Thank you, everybody, for being here, for showing up. Take care and stay healthy. I'm Cristina Londoño with Telemundo News. Thank you so much. Bye-bye.